Hello, today we're going to deal with 100 MCQs. So the first question, the palatine bone furnishes the link between. The options are maxilla and the sphenoid bone, sphenoid and the ethmoid bone, sphenoid and the vomer, and none of the above. And the correct answer is maxilla and the sphenoid bone. Coming on to the second question, the nerve supplying the submandibular gland. So which is the nerve? Is it the 5th, 9th, 7th or the 12th cranial nerves? So the answer is 7th cranial nerve. Waldear's lymphatic chain is formed by all except. So the question is except. So the options are palatine tonsil, pharyngeal tonsil, tubal and lingual tonsil, and posterior auricular nodes. So the correct answer is posterior auricular nodes. So Waldear's lymphatic chain is formed by palatine tonsil, pharyngeal tonsil, and tubular and the lingual tonsil. It doesn't contain posterior auricular nodes. Coming on to the next question, the base of the tongue is attached to which of the following? The first one, hyoid bone, second mandible, both hyoid bone and mandible, and the last one, none of the above. And the answer is C, that is hyoid bone and mandible. Coming on to the fifth question, the number of branches of the internal carotid artery in the neck. So whether the internal carotid artery has got branches in the neck? No, there are no branches. Okay, so the option is first one, none. Now coming on to sixth question, the most important function of hydrochloric acid in the stomach is whether destruction of bacteria or neutralization of the chyme, activation of the pepsinogen, and stimulation of pancreatic secretion. So the most important function of HCl in stomach is to activate the pepsinogen. Okay, so the option is C. Coming on to the next question, an important non-respiratory function of the lungs. Seventh question, an important non-respiratory function of the lungs. So whether it does anion balance or sodium balance, potassium balance, or Ca+2 balance. The answer is it goes for sodium balance. Okay, sodium balance. Eighth question, what is the GFR? Okay, so glomerular filtration rate. How much is it? Per minute it is being asked. 100, 125, 150, 175. The correct answer is 125 ml per minute. Coming on to the ninth question, two major types of muscle fibers are found in humans. Which are they? White is definitely an answer. So with white, which is the option? Brown, yellow, grey and red. Definitely the fourth one, white and red are the two muscle fibers found in humans. Coming on to the 10th question, the velocity of conduction in the Purkinje fibers of the heart is how many seconds? 1 to 4, 5 to 8, 9 to 12 or more than 12. So the velocity is 1 to 4 m per second. Okay, the first one. Virchow triad involves all except, the question is except. So Virchow triad consists of status of the blood, second one hypercoagulability, endothelial injury or platelet plug. It doesn't contain hypercoagulability. So all the other options are correct. Status of the blood, endothelial injury and platelet plug are present in Virchow triad. So the answer is hypercoagulability. 12th question, liquefaction necrosis is commonly seen in which organ? Brain, lung, liver or spleen? The liquefaction necrosis is mainly concerned with brain. Okay. Coming on to next one, edema occurs due to increased capillary permeability or decreased capillary permeability. So that itself gives you either A or B. So edema occurs due to increased capillary permeability. Coming on to 14th question, for wound healing, which mineral is helpful? Calcium, selenium, magnesium or none of these? So for wound healing, the most important mineral is magnesium. Okay. Coming on to the 15th question, Casson's disease is caused by amniotic fluid embolism, hypercoagulability, air or gas embolism, tumor embolism. So it is an easy answer. Casson's, remember air, Ca, air. Okay, air or gas embolism. Option is C. Coming on to 16th question, very easy. Amphotericin B is given for which of the given condition, whether it is a fungal or viral, bacterial or rickettsial. So amphotericin is an antifungal. So the option is A. 17th question, the principal therapeutic action of the glucocorticoid is whether it is anti-diuretic or anti-anabolic, anti-infective or anti-inflammatory. So glucocorticoids, they are given for diabetic, so anti-diuretic. 18th question, which of the following antileptic agents cause irreversible side effect of gingival hyperplasia? Whether ethosuximide causes gingival hyperplasia, phenobarbital, sodium valproate, or none of the above. None of the above, okay, is the answer. Fourth one, none of them causes irreversible side effect. Okay, now 19th question, combination of ampicillin and gentamicin is an example of what type of drug? So indifference method or synergisy or antagonism or bacterial symbiosis. It's actually synergisy method, okay. Ampicillin and gentamicin combination is a synergistic method of approach. 20th question, all of the following about anti-emetic drugs are correct except is the question. So let's see the first option. Domperidone blocks the D2 receptors in CTZ and upper gut. That is right. Domperidone causes dystonia. That is correct. DD. Ondansetron acts on selective 5-HT3 receptors. That is also correct. But the last option, ondansetron may cause vomiting by affecting the cytotoxic antigen receptors, is a wrong answer. Okay. So which is not correct? The last one. Albinism is a genetic disease that results in the incomplete metabolism of which of this? Histidine or cysteine or tyrosine or alanine. So it is tyrosine. Albinism is genetic defect that results in incomplete metabolism of tyrosine. Which of the following is a monosaccharide? Which is very easy question. Maltose, sucrose, fructose or starch. The one which is seen in fruits, that is fructose, is a monosaccharide. All are derived of the cholesterol except, so what are the derivatives of cholesterol? Chenodeoxycholic acid, glycocholic acid, testosterone, cholecystokinin. Here chenodeoxycholic acid is a derivative of cholesterol, glycocholic acid is a derivative of cholesterol, testosterone is a derivative of cholesterol. So the answer is cholecystokinin. Coming on to 24th question, pernicious anemia occurs in vitamin B1, vitamin B12 deficiency, vitamin C or vitamin D. So you know it's an easy answer. Vitamin B12 deficiency causes pernicious anemia. Pick the odd one out. Lactose, maltose, sucrose or cellulose. That is also easy. The one which is odd one out here is cellulose. 26th question. Riddle-Walker test is used to determine the efficiency of the disinfectant, moist heat sterilization, antibiotics or dry heat sterilization. Riddle-Walker test is used to determine the efficiency of a disinfectant. Okay, option A. Riddle-Walker test is used to determine the efficiency of a disinfectant. The specific test for Treponema pallidum. They are asking specific test. Just note the question, specific test. The test which is specific for Treponema pallidum is option C, TPHA. TPHA. Next one, viral action is differentiated from the bacterial action by, in both of them we have toxin production, we have lymphocyte production, neutrophil production. So the one which is making them different is interferon production. Okay, so option A. 29th question, all dentists must take a prophylaxis for hepatitis B by vaccinating themselves at, so what is the duration of hepatitis B vaccination? That's a question. So when you look into the options, option A, B, C, there are 4 intervals required. So actually the option 4 is very easy to pick up. Hepatitis B is given in 4 doses, 0, 1, 2 and 12 months interval. So option 4 is the answer. Option D. Now coming on to 30th question, parasitic inflammation would show predominantly if you have a parasitic infection, definitely your eosinophil count will go high. So option C is the answer. Pulp chambers and root canals are in deciduous teeth. So the pulp chambers and root canals in deciduous teeth are how it is, whether it is wide and deep, shallow and narrow. So the shallow definitely pulp chambers in deciduous teeth are shallow, but it is not narrow, it is wide. So the option 4D, okay, shallow and wide is the answer. Pulp chambers in deciduous teeth are shallow and wide. Coming on to 32nd question, most common morphological variation. So the answer is very easy. Maxillary lateral incisor is the most commonly seen tooth with variation, morphological variation, option A. Coming on to 33rd question, maxillary primary cuspid enamel completion takes place at which time duration? Maxillary primary cuspid, okay, so it is the only tooth, primary tooth, okay, after birth. The completion of enamel takes place is the canine, primary canine. So 9 months after birth is the option. So D, maxillary primary cuspid enamel completion takes place at 9 months after birth. Now coming on to 34th question, the key to occlusion is whether it is maxillary, which tooth, permanent first molar or second molar. So option A is the correct answer, maxillary first molar. Maxillary permanent first molar is the key to occlusion. 35th question, the side towards which mandible moves is called option A, tooth contact side, balancing side, working side, non-working side. The side to which the mandible move is called as working side, okay, option C. The following structure acts as a buffer against physical forces in the enamel organ. So whenever there is a hit in the tooth bud, that enamel within the enamel organ, which structure will act as a buffer? Option A, stratum intermedium, option B, outer enamel epithelium, option C, cervical loop, option D, stellate reticulum. Obviously, stellate reticulum, option D is the correct answer. 37. All are true about this triad of Retzius except constitute the rest lines within the enamel rod. They have high inorganic component. They are areas of increased porosity. Last one, allow the movement of water and small ions. So as we have learned, striae of Retzius mainly contains organic content, not inorganic. So option B is the correct answer. Tomb's fibers are without but not within the dentine. Odontoblastic processes in the dentinal tubules. Type of Sharpie's fibers originate from the Tomb's granular layer. Tomb's fibers are actually seen within the odontoblastic processes within the dentinal tubules, okay. Wheel zone of pulp. Next question, the wheel zone of pulp is seen cell degenerated zone, cell rich zone, cell free zone, or cell regenerated zone. It's very easy. Wheel zone is actually cell free zone. There are no cells in that area. Question number 40. Cementum is primarily amorphous, organic, inorganic, or soft tissue. It is an inorganic structure primarily. Question number 41. Retentive grooves in the proximal box of a class 2 amalgam cavity should be. The retentive grooves should always be rounded and they must be elongated in the dentine. Okay, round and elongated in the dentine. Retentive grooves must always be rounded and elongated in the dentine. Question number 42. Cavity varnish is used for what? To reduce the thermal conductivity, to reduce the permeability of acid into the dentinal tubules, action as an obtendant, or all of the above. All of the above is not an option because cavity varnish is mainly used to reduce the permeability of acid into the dentinal tubule. So option B is the correct answer. 43. The pin that causes minimum stress in dentine will be the one which is cemented. So option B is the correct answer. Cemented pin will cause minimum stress in the dentine. Question number 44. The calcium content in alloyed electrolytic precipitate. How much calcium will be present in the alloyed electrolytic precipitate is 0.10%, 0.20%, 0.50%, and 0.80% each. 0.10%. Re-etching saliva. Re-etching saliva, contaminated etched enamel should be done for. So you have to re-etch the tooth which is already being contaminated by the saliva. So how many seconds you will etch? Around 30 seconds. Option A is the correct answer. 30 seconds re-etching must be done. Question number 46. If the pulp of a single rooted canal is triangular in cross section with base of the triangle located facially and apex is located lingually with the mesial arm longer than the distal, mesial arm longer than the distal. The tooth is most likely. So a triangular cross section of root canal is seen mainly in maxillary central incisor, and that too mesial arm longer than the distal one is another clue. So the option is maxillary central incisor. Question number 47. Pain temperature touch from pulpa carried by which one of the following type of the nerve fibers? Mainly A delta fibers. Option C. Question number 48. Which of the following is a disinfectant, sterilizing agent and an antiseptic? The one which acts in all the three possibilities: disinfectant, sterilizing agent and antiseptic. First option, sodium hypochlorite, glutaraldehyde, hydrogen peroxide and methylated spirit. So the answer is option A, sodium hypochlorite. Question number 49. Sequence of endodontic instrumentation. So which one will you use first? A file, a broach or a reamer? So the one which you should use first is file. Secondly, you should use a reamer. Thirdly, you should use a broach. FRB. Okay, file, reamer and broach. That's the order. Question number 50. Silver cone used as a root canal filling material is indicated in what type of canals? So if you are not able to, if you have narrow canals and you have curved canals, okay, so in such conditions you go for silver cone. So option A, narrow curved canals in which enlargement beyond a number 20-25 instrument is unadvisable, is the option. Coming on to the next question, 51. Globulomaxillary cyst is actually, just check it out whether it's a soft cyst or a bony cyst. It is actually a bony cyst. So option B is the answer. It is between incisor and cuspid but is a bony cyst. Coming on to 52. Which of the following is most likely to turn malignant? Intradermal nevus or junctional nevus or lichen planus or papilloma? So among this, junctional nevus, option B is the correct answer, which will turn malignant. 53. Which histopathological type of odontogenic keratocyst is commoner, more invasive and has greater tendency for recurrence? Always a parakeratinized OKC has got more tendency for recurrence. 54. Silolitha stones found in the salivary duct and gland and are primarily composed of what? They are mainly composed of hydroxyapatite. Option A. 55. Ammonia will cause, whether it will decrease the plaque or it will increase the plaque or increase the calculus. Option C is the answer. Ammonia will decrease the plaque formation. Option C. 56. Scammons growth curve. What is false about this? Sentences. First one, neural tissue, most of the growth is completed by 6 years. That's correct. Lymphoid tissue growth reaches 200% by age 13 and then it regresses afterwards. That is also correct. Genital tissue, most of the growth is completed by the age of puberty. That is wrong. Genital growth doesn't complete by the age of puberty. Okay, so option C is the answer. 57. Lewy space. How much is the lewy space? It is 3.4 mm and it is more in which area? It is more in the mandible, greater in the mandible. Question number 58. The patients with class 2 division 1 malocclusion will have the upper lip will be hypotonic in such cases. So the option B is the correct answer. Option C will be the D will be the correct answer. Hypotonic upper lip. Okay, hypotonic upper lip. Question number 59. Ashley-Howe model analysis is used to predict tooth material excess or maxillomandibular relationships, basal bone transverse relationship or growth prediction. Okay, so Ashley-Howe actually predicts the growth. So it is mainly used for growth prediction. The angle of convexity is mainly which angle? Between point A and point B. So it is option the angle of convexity is between Nasion and Pagonian. So option C is the right answer. Nasion and Pagonian. Angle of convexity is between Nasion and Pagonian. Okay, question number 61. Reinforcement technique is based on Skinner's theory. Okay, so we have learned in pedo the reinforcement technique is based on Skinner's theory. Question number 62. Methods of modifying the stainless steel crown for primary teeth were given by. So when you have to modify the stainless steel crown for a primary tooth, this particular method was given by Ming and Hill. Okay, option C, Ming and Hill. Question number 63. Pediatric fracture of the body of the mandible. Which of the following is true of fracture line? In case of a pediatric fracture in the body of the mandible, the fracture line will be always downward and forward. So option A is the correct answer. Downward and forward. It is not downward and backward. It is not in a zigzag line. It is not in a straight line. It is always downward and forward. Coming on to 64. Best filling material in deciduous teeth for RCT. So we have always learned in pedo the best filling material in for deciduous tooth is ZOE. Okay, zinc oxide eugenol. Among the options, ZOE is the good answer. 65. Difficulty in grasping objects is characterized by which type of cerebral palsy? Okay, it is mainly seen in ataxic type of cerebral palsy. Okay, not in dyskinetic, not in spastic, not in mixed. Ataxic type of cerebral palsy has got this particular type of grasping difficulty. Now question number 66. The darkening of radiograph X-ray depends on all except. The question is except. So darkening of the radiograph depends upon the thickness of the object. That is true. Quality and quantity of the X-ray. That is true. Velocity of electron emitted from cathode. That is also true. Not based on the angulation of the cone. So option C is the answer. 67. First complication after radiotherapy. So after the first radiotherapy, your oral cavity will be inflamed. So the first common complication will be mucositis. Okay, option A. Question number 68. The operator should stand at what distance while taking X-ray? The operator should stand at least 6 feet. 6 feet from the X-ray machine. Okay, 6 feet. Initiator in development solution will be. So in case of an X-ray developing solution, the initiator is, which is the initiator? Acetic acid, sodium thiosulfate, hydroquinone, or potassium bromide. Initiate sodium thiosulfate. Okay. Now 70. Digital image in computerized radiography is made up of. Digital image in computerized tomography is made up of pixels. Okay, not CCD, not CMOs, not silver halide crystals. Coming on to 71. What is a characteristic of normal distribution? If it is a normal distribution, all the mean median mode will be same. Okay, so option A. 72. A disease seen in excess of normal in a community results in. So something is excess, okay, than normal. So obviously it will become a epidemic. Okay, not a pandemic, not an endemic, not an endozootic, it is epidemic. 73. All of the following measure plaque index except, the question is except, Ramford index measures the plaque, Moller's index measures the plaque, OHIS index, so the one which doesn't measure the plaque is Lowen's illness. The daily recommended dose of fluoride for the children below 3 years will be maximum is 0.5 mg of fluoride to a child per day. So 0.5 mg. So option A. KD's activity increased in cases of xerostomia, sugar diet, taking much carbohydrate food, and none. So KD's activity suddenly increases if you having xerostomia. Option A. 76. Gingival coal is orthokeratinized, parakeratinized, both para and ortho, and non-keratinized. Gingival coal is non-keratinized. Option D is the answer. 77. Specific plaque hypothesis was put forward by. So the specific plaque hypothesis was put forward by Loche, isn't it? Loche. Specific plaque hypothesis was put forward by Loche. Option C. 78. Bacterial enzyme detected in GCF is phospholipase. Option C. Fibronectin, no. Cytokines, no. Myeloperoxidase, no. The one which is seen bacterial enzyme in GCF is phospholipase. Okay. Green stains frequently seen on the children's teeth are mainly caused by materia alba, no. Enamel defects, no. Dental defects, no. Yes, chromogenic bacteria. It is caused by chromogenic bacteria. Green stains are caused by chromogenic bacteria. Coming on to 80th question. The change in color, shape and texture of gingiva are seen in. All the things are changing. Color is changing, shape is changing, texture of gingiva is changing. So all this happens in which stage? 1, 2, 3 or 4? It happens in stage 3. Option C is the right answer. 81. Apex elevator utilizes which principle? It mainly utilizes option A, wedge principle. Okay, apex elevate utilizes a wedge principle. Question number 82, which of the following is used to prevent the laryngospasm due to GA? So when you give a general anesthesia, if you encounter with laryngospasm to the patient, what will you medicate? So mainly you have to give succinylcholine. Okay, option D is the right answer, succinylcholine. Question number 83, the fracture of the tooth bearing portion of the mandible. So the tooth bearing portion, if it is fractured, then it is called a compound fracture. Okay, compound fracture. Question number 84, in case of Leaford 3 fracture, all are seen except. Do you see a CSF rhinorrhea? Yes, in Leaford 3. Fracture at the frontozygomatic suture? Yes. Whole face will be mobile? Yes. So what is not seen? Crack pot sound on the tapping tooth is seen in Leaford 3? Yes, that is also seen. So the last option which is left is none of the above. So all of these are seen in Leaford 3 fracture. Okay, so none of the above. TMJ is a diarthroidal gingivoglidal joint. Oh, that definition itself is given there. Ball and socket joint, no. Hinge joint, no. Fibrous joint, no. So option A, diarthroidal gingivoidal joint, TMJ. Question number 86. Occlusal offset in an anterior partial veneer crown may generally be necessary to provide. It will give you retention or conservation of tooth structure, aesthetics or structural durability. So if you give a occlusal offset, it will always give a structural durability. Question number 87. The ideal occlusal clearance for a complete cast crown on functional cusp is around 1.5 mm. You have to give the clearance. Okay, occlusal clearance for a complete cast crown on functional cusp is 1.5 mm. Indicated finish margin with porcelain fused to metal restoration is shoulder with bevel, heavy shoulder, heavy chamfer. So the one which you give for a PFM crown is porcelain fused metal restoration is shoulder with the bevel. Dicor is what? A castable ceramic or metavite or Vitalium or Vita ceramic. Dicor is a castable ceramic, option A. 90. In the posterior maxilla, the pontic of choice will be, what type of pontic will you choose? Sanitary, point contact, bullet shape, modified ridge lap. In the posterior maxilla, you should always go for a modified ridge lap pontic. Question number 91. Modification spaces in Kennedy's classification are spaces other than the original class, space posterior to all of the teeth, space anterior to all teeth, additional space in class 4. So the correct answer is option A, spaces other than the original class. 92. Lingual bar is used in conditions where lingual sulcus deep or shallow, option A or option B. When you have a lingual sulcus which is deep, you should give a lingual bar, option A. Indirect retention for a partial denture is achieved from which one of the following? Indirect retention you need. So you give a lingual bar or lingual plate, or palatal bar or double palatal bar. So to get indirect retention for a partial denture, you have to give a lingual plate. 94. Surveyor is used on master cast for what? To locate the guiding plane, to determine the aesthetics, to delineate the areas of maximum convexity, to locate the undercuts to be used for retention or to be blocked out. So it is given for surveyor is used for locating the undercuts. Okay, undercuts. Now coming on to 95, altered cast technique is used in class 3 or class 2 or class 3 modification class 4. Altered cast technique is used in class 3. KHN value of amalgam is how much? 90, 343, 67, 450. KHN value of amalgam is 90. Okay, 90. KHN value of amalgam is 90. Which material undergoes hysteresis? Irreversible hydrocolloid or reversible hydrocolloid, or impression plaster, or a metallic oxide paste? Okay, so the material which undergoes hysteresis is a reversible hydrocolloid. Okay, reversible hydrocolloid. Type 1 gypsum product is also called as impression plaster. Okay, type 1 gypsum product is impression plaster. 99. Light cure system side effect is So if you use a light cure system, mainly your retina will get damaged. So option 4 is the right answer, retinal damage. Light cure system, side effect is retinal damage. Coming on to the last question, the dental amalgam is most resistant to what type of stress? Compressive stress or impact stress or shear stress or tensile stress? The dental